Welcome to the final segment of DermTV Viewer Questions Week for May 2012. Today's episode will feature questions from DermTV YouTube viewers. Hello, I'm Dr. Neil Schultz, and welcome to DermTV. Today's first question comes from Mac Maniaca, who says, Dr. Schultz, is it true that extracting, squeezing of clogged pores causes damage to the tissues? Well, if it's done properly, it shouldn't cause any damage. And if it's done improperly, it can cause some scarring. Let me explain. When you're trying to push out a clogged pore, a blackhead or a whitehead, you have to make sure that when you're pushing it, that you're not squeezing the skin together. Because if you squeeze the skin together, how is the material going to come out? If you're putting a lot of pressure on it and it's got no avenue of egress to come out, it's going to rupture internally. If the material inside the pimple ruptures internally, it sets up what we call a foreign body reaction. It's like a splinter. It doesn't belong there, that material. And as a result, that can cause scarring. When you want to push these things out, you need to push down and under the pore. If you do that, then you're not clogging the skin at the top. You're applying pressure down and under so the material can come up out through the pore. That's the way an esthetician does it. That's the way the instruments do it that I use in my office when I'm having my nurses remove clogged pores, blackheads and whiteheads from patients. So this doesn't require 8 years of postgraduate medical education to finally figure out how to do this safely so you don't cause any marks. Our second question comes from EOHPITT. Do you recommend collagen drinks? I saw a lot of people now advertising these drinks that they can promote a healthier skin from the inside. Are they effective? What's your opinion? I believe that we should all eat well-balanced diets, eat nutritious food, but I don't think that you can make your skin better or improve the collagen content of your skin by drinking collagen drinks. First of all, when you drink a collagen drink, the collagen gets digested in your intestinal tract before it's absorbed into the bloodstream. So the collagen is all broken down into the amino acids. The collagen does not then reform in your skin. I understand the rationale. I understand the appeal of being able to have more glowing, more beautiful skin just by drinking a concoction. But whether it's a collagen drink or any other special nutrition drink, you may be able to get energy, but you're not going to get better collagen in your skin, which you can get with topical skincare products. Third question is, what do you think of homemade vitamin C serums? And this comes from Alasnel. Alasnel, the problem with homemade vitamin C serums is that most people use vitamin C tablets, which is just ascorbic acid. And when you empty that, the powder from the capsule or crush the tablet, it just dissolves in water or alcohol, whatever you're using. And that plain ascorbic acid, number one, is not stable, which means it oxidizes rapidly. Of course, if you're using it that night, it's not going to oxidize, it'll be stable then. But the real problem is that the form that you're using it in is water-soluble. And the skin doesn't absorb water-soluble things as well as it absorbs lipid-soluble things. As a result, the plain ascorbic acid in the powder form that you've reduced it to, it's very hard for it to be absorbed. The two best ingredients for absorption and for stability for topical vitamin C preparations are methylsilanol ascorbate and tetrahexadecyl ascorbate. That's what I have in my products, and that's what are in better topical vitamin C preparations. I don't want you to be disappointed by not getting results from homemade DIY vitamin C preparations. They're probably not going to give you the antioxidant protection that you're looking for. Fourth question comes from Stick It Out Till the End. Great name. I've seen on a popular television show that skincare products that come with screw-off lids become less effective over time because as you open it and it's exposed to the air, the ingredients break down. The show went on to say that we should refrain from buying products in these types of jars and to only buy products in squeeze tubes or with pumps. How accurate is this information? Is it true to your knowledge? The reality is, if you're going to keep any product, whether it's in a pump or a squeeze tube or an open jar, if you're going to keep it for many years, there can be a question about the stability. But I have to assume that any product you're using, you're going to use up in 6 months or a year. And under those circumstances, the amount of air that the product is exposed to in a jar by taking the lid off, putting it back on afterwards, there just isn't going to be that much exposure to cause degradation of the product. And the reason I can say that is because the skincare companies that make these products, they know how you're using it, they know what you're doing. They can't afford to have it degrade. So they've tested their products and they make sure that there's stability under these circumstances. I understand the convenience, and it seems a little bit more hygienic if you're not sticking your finger into a jar as opposed to just getting it out of a pump or a tube, but I don't think there's a problem with stability under those circumstances. The next question comes from Carl Sanoff, and Carl asks a terrific, terrific question. He says, I realize the skin doesn't have a feedback loop when it comes to recognizing if moisturizers are already present. There have been studies done that have demonstrated that if the epidermal skin barrier undergoes damage, which he calls acute disruption, the skin will respond with lipid or fat synthesis in a homeostatic way, meaning a positive feedback. The total transepidermal water loss seems to be a trigger of this synthesis. Transepidermal water loss is a fancy term for the drying out of the skin, but the point is he's discussing a positive feedback mechanism. What do I think about this? And he says he can provide citations. Carl is really referring to my having said that the only thing that controls oil production or lipid production is hormone influence on the oil gland, not how much oil you've taken off the surface of the skin. So over drying, over cleansing does not cause more oil production. What Carl is talking about is damage to the epidermal cells at the top of the epidermis or in the middle of the epidermis. And yes, if those cells are damaged, and as a result of that damage, the barrier function is lost, so more water evaporates, the body has a homeostatic way of repairing those cells and putting more lipid into the cells and into the barriers between the cells. It's sort of like the mortar between bricks to help restore the barrier function. That lipid production has nothing to do with oil gland production and secretion, which is what I was referring to when I said that you can't make the oil glands make more oil. That oil is oil that comes out of the oil gland, goes up the duct, and lies on the surface of the skin. That has nothing to do with what's going on inside the cells. So Carl, you are correct. The skin, the epidermis does have a way of making more oil for internal repair within cells. We call that intracellular. And the extracellular cement that holds them together has nothing to do with oil production by oil glands for the sebum that comes out and makes our skin oily or that helps contribute to acne. So that's it for this month's Viewer Questions Week. And don't forget, the subjects from so many DermTV episodes come from your questions, which are great. So please keep sending them in, and I'll keep answering as many of them as I can. Please join me again at dermtv.com. If you have a question, please send it to me by visiting dermtv.com/question. I'm Dr. Neil Schultz, and thank you for watching today.